My name is Audrey. I have a disability, SCP. And I just want to let you know that keep my aspect of my life is very limited. So having a job or a life out of my program is very important to me. Thank you.
Hi, my name is Sandy Waterbury, and this is my daughter Shannon, and I'm currently the Vice President of the ARC of California, and I'm on the board of the ARC of Ventura, and I appreciate seeing you at our public policy conference a few weeks ago. I'm here to tell you a little bit about the day in the life of Shannon. Shannon is diagnosed with cerebral palsy, developmental delay, short bowel syndrome, and a few other things. She's now IV dependent. She's TPN fed. A lot of needs. It's not all doom and gloom. She has a very happy life. She loves to go swimming. She loves music. She loves her family. She has 3 big brothers. She has a good life, but it's a struggle. It's a daily struggle. I worry about all the cuts overall, the caps on respite. My daughter gets in home support services. As you can imagine, she gets the maximum hours, and I'm her care provider. I work part-time as a special education teacher. I substitute, but her care is a lot, and I just want to know how these compile on you, all these cuts compile on a family, and how devastating it can be. And I want you to know I appreciate you letting me speak, and thank you for your support.
Thank you.
Good afternoon. My name is Andrew Gamboa. I am part of the group that was just up here. The services that I receive allowed me to be here today. Without them, I would be stuck at home. I strongly urge you to consider all the things that are in the letter. Thank you.
Thank you.
My name is Joe Matters. I'm a taxpayer of California. It is time to close development centers. So I support the plan that will close the development centers as taxpayers' money. Make it worthwhile. Don't waste it. Thanks.
My name is David Mulvey. I represent the SEIU Developmental Disabilities Council. We represent regional center and program workers across the state of California. I just want to briefly highlight the position that agencies that provide direct supports have been put in because of these cuts. I've been working recently with a group here out of Stockton, and I've been talking to workers there, and they've been telling me about the horrible decisions they're forced to make as to whether or not to stay home to care for their sick children or take a day without pay in a job that is barely allowing them to make their ends meet. Similarly, they have to decide whether or not they themselves will go to work sick and risk transferring that illness to the people that they work with and care for and love at their day programs, or give up a day's pay. This isn't because the agency doesn't want to provide benefits to those workers. It's because the rate will simply not support that, and we hope you do your best to change that. Thank you.
Thank you.
Evelyn Abu Hassan with Disability Rights California. I have provided a significant amount of testimony in writing, so I'm going to keep this short and just try to highlight a few things. As Catherine Blakemore, my executive director, said, the community has now become the safety net. So we really need to focus on a few things. And of concern for Disability Rights California, as many have said before me, is the issue around IHSS and what that means to families of individuals with developmental disabilities who are typically at home with their families being their provider, without figuring out a way to fully fund the new overtime issues. People with developmental disabilities are going to end up in institutions where we don't want them. Also, I want to talk a little bit about early start. I agree with many of the comments that Mr. Rollins said. We want to see full restoration of early start. We also know that the administration scored about 19 million when they made those savings, and we know that that money can really be used for families and young people so that they can be more move forward in a way that's healthy for them and not be delayed in the way that it's been in the past. Thank you very much.
Thank you.
Hi, my name is Kelly Young, and I am a parent of a child who received early start services, so I'm here to talk about the babies. When I brought my daughter home from the intensive care unit, I was afraid, I was overwhelmed, and I was alone. And Early Start provided me with information, the resources, and the tools I needed to raise my daughter. Over time, I learned about my daughter, the services that were available, but most importantly, that I needed to be an active participant in advocating for my daughter throughout her lifetime. Early Start provided me with a strong foundation because it recognizes that the family is the constant in a child's life, and that services should support and enhance the family's capability to meet the special developmental needs of the child. As it's already been discussed, Early Start has been greatly diminished by the cuts. I would urge you to, again, look at the eligibility for at-risk kids, providing more parent-to-parent support, which is really important, looking at the insurance mandate and the ICC, public input, and personnel development. Thank you.
Thank you.
Dr. Weber, member of the committee. My name is Antonio Ranit. I am an RN administrator. I'm representing a large minority group of Filipino residential care providers in the Sacramento area and other outlying areas. First of all, I'm in support at the Landerman Coalition proposal. Secondly, I'm as an ICFDDN operator of 3 facilities in this Sacramento area. I just don't see the numbers just don't add up when we support the $450,000 per consumer in a DC, wherein at the ICFDDN level here in the community, we support $7,000 with lots of cuts that we're still sustaining. We need some help. Thank you.
Thank you.
I'm Gina Wastag from the United Filipino Care Providers and Caregivers, and they're here with me. We are arm rate facilities. Due to rising costs, reduced beds to 4, more and more care homes are closing at alarming rate. When care homes close, everybody loses. Our intellectually disabled consumers are immediately relocated, causing transfer trauma. Care providers and caregivers like us lose our livelihood. Homes go to foreclosure. Our cost to the government is a fraction of the cost of the state development centers at a ratio of 1:13. We are here asking for your help. We need 12% rate increase in July 2014 and another 12% rate increase in January of 2016 as we are minimum wage. 60% of our cost is labor costs. We say no to 4 beds. Our break-even point is 5 beds. We are operating at a loss at 4 beds, and we need your help to seek a 2-year moratorium to labor audit. Thank you very much.
Thank you.
Good afternoon. My name is Boyd Bradshaw, President of Res Coalition, also a member of the Landerman Coalition. A number of my colleagues have already brought some issues, so I'll try and keep it fairly brief. However, we do need to address what has been discussed from DDS with regards to the minimum wage increase. Neither DDS or the LAO did address the arm rate structure minimum wage increase, and that's something we need to take care of because there's 6,000 residential care providers in the state that at this point DDS nor the LAO has addressed how they're going to achieve the minimum wage increase for those particular individuals. Also, we did want to clarify with regards to an effort to roll back some of the recent new requirements, which would include the audit process. There were 1,400 audits done. If you average $10,000 per audit, that's $14 million that was dedicated to the audits that the development the system said would identify fraud and graft, and not a single one of those has come back to identify that. So we need to go ahead and look at pulling that back. Thank you very much.
Thank you.
Hi. My name is Lauren Marks. I've been a social worker with GGRC since 2008, laid off due to the budget cuts and hired back in 2010. I've seen how the increase in caseloads has affected how we serve the individuals and families. And due to the high volume numbers alone, when we have crises, there's more than one at a time. We're helping people with homelessness, forensic cases, CPS, APS, mental health issues, and the integrity of the way that we provide services has been affected. The solution is that we need a federal commitment to adjust the caseload ratio. This is from our Marin office. As social workers, we are well-educated professionals, yet the wage does not come close to reflecting the cost of living in our geographic area. The position has varied duties, and families may benefit from social worker longevity. High turnover for social workers means less continuity. Can't say that word for families. Thanks for listening. Continuity.
Good afternoon. My name is Eric Zigman. I'm the Chief Operating Officer of the Pomeroy Center in San Francisco. It's a provider of services and supports since 1952, some 18 years before the Lanterman Act really got rolling in California. The Service Providers Advisory Committee has a 6-point paper with a page on the back that has action items for the committee, so I won't obviously be able to do that in a minute. What I did want to say is the Lanterman Act talks about California taking responsibility to have people with developmental disabilities approximate the patterns of everyday living that people without disabilities have. The 1985 Supreme Court decision in the state reified that in terms of funding, and as you heard from some of the people served, their needs are around services and supports, and the disabling environment has to do with how we fund those. I wanted a second early start. I wanted to say one last thing about employment, which is think about how much identity people in this room draw from their jobs every day. And having an employment first policy in California without a pathway to realize that policy is a disservice. And I think we have some suggestions on how to create a structure so less than 75% of people with developmental disabilities can be unemployed and more can be employed. Thank you.
Hello, my name is Dan Roth. I've been working as a social worker at Golden Gate Regional Center for 13 years. When I started, I had 65 people on my caseload. I now have 90, and I can tell you that this nearly 50% increase in my caseload has taken its toll. There's more paperwork. There's less time spent with the people I work with, talking to the families, caregivers, and just being able to take the time to find out what's really needed. This is very frustrating and stressful for us as social workers because we can't provide best practice. And of course, this hurts the people we serve. We're asking for more money to be allocated to the operations budget of the regional centers based on realistic, up-to-date staffing formulas so that more social workers will be hired. And this will reduce our caseload. This will mean better services for the people we work with. This is the right and fair thing to do. Thank you for listening.
My name is Sanel Siban. I'm a social worker. I concur with what Dan just said. We need to request the Assembly to increase operational budget. And yesterday I went to visit one of the families that we save, and as I was in the house, I found that Mom was distressed. She was crying because she just separated with her husband who just lost his job. Because of that, the care that she's giving to the individual I provide services to has declined because she needs help herself. But in the process, I was impelled to want to just do my paperwork and leave. But because of the severity of the nature that this woman was going through, I couldn't help but take a little bit of time to talk to her and console her. As a social worker, I feel this is my responsibility to be able to be there for the families that we provide services to. And without appropriate operational budget, we are not able to do so.
My name is Florence Lam. I've been working as a bilingual social worker at Golden Gate Regional Center for 18 years. In that time, I have seen the positive impact of regional center service on individuals and families. I would like to share a memory with you. When I started at GGLC, a mother holding her 6-month Down syndrome baby crying in front of me. She told me that she did not know what to do and did not know to raise up her daughter. I was able to take the time to listen to her concern and share with her the resources available in the community. Her daughter now is 18 years old and doing well in school and living a full life. Her mother told me that without our support, she would not have been able to smile and to have hopes. As a bilingual experienced social worker, we face a lot of challenge in our work. There is not enough time for me to provide support to listen to them, plus limited bilingual community resources, especially for the autistic population, such as behavior consultation, ABA services, psychiatric services. We need to spend a lot of time to be with the family, to explore, to access, and to advocate the services in the community. However, the reduced community resources through budget cuts and increasing caseload has resulted in decline of quality of service we can provide to them. I spent most of my whole working life at GGLC. I love my job. I love my client and their family. I love to see the progress they make, give them hope so that their life will be meaningful and they can contribute back to the community. Finally, I want to add my voice to a comment made by Golden Gate Regional Center Executive Director, Mr. Jim Shorter. Thank you for your listening.
Hi, I'm a social worker at Golden Gate Regional Center. I've been there 22 years. I'm a bilingual social worker. I've seen a lot over my years. I started with 62 clients, and now I've got 89 clients. I feel like I'm the navigator for them, and I'm their voice because they can't access their services, whether it's fighting with the school, fighting with, or representing them with their medical practitioners, and making sure that they get the services that they need. I really believe in early start intervention for these autistic kids who kind of outnumber all our population right now. And I believe in my relationship with them, and I feel like living in San Francisco and working at Golden Gate Regional Center, I can't afford to live there and work there. And I believe that the quality of the work that I do really they do get the services that they need. And I thank you for your caring, and I thank you for listening.
Thank you.
Hi, my name is Amanda Pyle. I work with Horizon and Oasis Day Programs, and I'm the co-chair of the GGRC Service Provider Advisory Committee, representing San Mateo, San Francisco, and Marin counties. Specifically, I support the actions that are outlined in the white paper that was just submitted to you today, specifically but not limited to a budget that supports increasing provider rates by 5 to 10%, restoring early start and supported employment funding, and increasing regional center operations by 5 to 7.6%. Service providers are continually asked to do more with less. Requirements around audits and employment are just a few examples of the requirements that we're asked to do. We're in support of these requirements, but we really need a budget that helps us ensure that we can still provide the services delivered and to meet these requirements. I'd just like to close by saying that our system needs a rate structure designed to sustain the system and to move the system forward. Thank you.
Good afternoon. My name is Francisco Arce. I've been working at Golden Gate Regional Center for 23 years as a bilingual social worker. I speak Spanish, that's my primary language. And I have a degree in social work from UC Berkeley. 90% of my caseload is composed by Spanish-speaking individuals with developmental disabilities. And I love my job. I enjoy meeting the people that I serve needs. But over the past year, I've seen an increase of my caseload, and that's increase. I've been putting a lot of pressure in my personal and professional life. And the reason for this day is a challenge to meet the needs of the people that we serve. And these needs are getting more complicated, requiring more time, and especially more intervention in terms of social work that is sensitive to the needs, the values, the needs, and the culture of these, the people that we serve. For that reason, I want to add my voice to the comment made by Mr. Jim Shorter, the director of the GGRC. Thank you.
Joan Schmidt. I'm a parent of a son who meets the criteria that Assemblywoman spoke about. He's a wanderer and has lived in the community now for over 20 years. He is in supported living. He has autism and is nonverbal and has all those labels that folks talk about. When my daughter went away to the Peace Corps, she said, wouldn't it be interesting, he was still home at that time, when I came home, if Darren answered the door and said, hi, I'm fine, but mom has supported living, for head slapping and screaming. Because this is what families truly do go through. So I'm very grateful for the community services here. I'm here to support the Lanterman Coalition, all of the points. I have a very good friend who started working in a developmental center years and years ago with all the stories, and now, and then retired from DDS some years ago, and he said to me, isn't it unbelievable that we have these kinds of community services, supported living and that sort of thing, in our lifetime? So I ask that we move from that and find a way to fund it and to really focus on how we can make it, what we know works, work. Thank you.
Thank you.
Hi, I'm Carol McKinney from the California Supported Living Network, and I also provide independent living and supported living services to about 275 people. And I'm fortunate to participate in the technical work group for the minimum wage increase, and really appreciate the department's willingness to work with us on this matter. There is a concern about the interpretation of the language with regard to the 2 times for the minimum wage for exempt employees, and any of you who have been in business in a former life or are currently know that it is part of the labor law. So I'd like to have more discussion regarding that as opposed to just the 8 to 9 and 9 to 10 increase, but the labor law is going to require this of us, so to keep that discussion going, I'd appreciate it, and I look forward to our future meetings. Thank you very much.
Thank you.
Hi, my name is Jackie Dillard-Foss, and I'm with the California Supported Living Network. Prior to coming here, I was on a phone call with a sister, and her brother is at Lanterman Developmental Center, and he is a wanderer. We had a discussion in regards to the services that could be provided through supported living services, and I hung up the phone with her, and she was very excited about the possibility of her brother now moving to live near her in Roseville, and he's in Lanterman. So that's exciting. He's been there for 47 years. So that is something we really need to talk about, and I really appreciate your comments on it. Does it make sense? These costs, do they make sense? I did a tour of Sonoma Developmental Center, and what I saw there was a building in warm shutdown. No one was in the building. It just cost money to keep it open just in case. So I'm saying, let's have the community get funded just in case that we're able to provide the services that are necessary. So I think we need to really focus in on what are we doing to the community as we continue to spend money on people that have decertified units. I don't get it. I don't understand it either. So I've been in this system for 20 years, and I'm getting older, and I'm hoping the day comes that I do understand it. I do want to recommend the 5% increase. We have killed this system. We have got to reinvest in this system so people that are doing the job day in and day out in the community can be funded appropriately. I'm not talking about regional center services. I'm talking about personal attendants who do the day in, day out job. So I really want to focus in on what are we doing to our community members and our employees that are in the community. Thank you.
Thank you. Melissa Cortez Roth, representing Autism Speaks. We are a member of the Lanterman Coalition, and I want to highlight 2 issues that were on the budget letter that they submitted, and that's early start and regional center copays and deductibles. On early start, I've heard from countless parents who have received services through early start, and their children no longer needed long-term services through a regional center. So there really is a cost benefit to fully funding that program. On copays and deductibles, what we're seeing is when a family can't afford their copay or deductible, the regional center is still required to deliver the service. So we have a delay in service, added administrative costs, and the regional center is still paying the copay. And in the case of deductibles, they're actually being required to pay the entire cost of services in some cases because of that prohibition. So we want to work with your office, and we'll submit language that we think addresses this issue. Thank you.
Thank you.
Madam Chair and members of the committee, my name is Joy Scott, and I have the privilege of running a respite agency, Tri-County Caregiver Relief, in Yuba City. Sorry, I'm a little nervous. And I'm also representing the California Respite Association, and we wholeheartedly support the Lanterman Coalition proposal that is put before you, and I was going to reiterate again the funding of the increase in minimum wage. Another concern is the overtime funding in January. And finally, the commitment to early start support services and removing the respite cap. And I want to leave you with this thought. Respite is the break that keeps the family from breaking.
Thank you.
Hello, I'm Michelle Ramirez, Executive Director of On My Own, serving 300 clients and 250 employees. I want to strongly urge you to support the letter put forth by the Latterman Coalition. I specifically want to highlight two pieces of that. I strongly want you to support the plan put forth by the DC Task Force. And just to give you a little facts, I support individuals right now for a fourth of the cost. And before I came here, I thought I'd pull 5 clients that we moved out of the DC in Sonoma and just run some numbers for you. I will save the state by the end of 2014 $1.5 million. I had to take a double look at my calculator to make sure I was correct, but it's true. I'm doing it right now, and they have a better quality of life. So I think our community needs the infrastructure, and we need you to fund all the policies that are passed. Thank you.
Thank you.
Hi, Dan Hogue, Las Trampas. We serve people in day programs, adult residential, independent living, and supported living services. And one of the things I think is actually really sort of shameful is the fact that we even have to talk about raising people's wages because of minimum wage increasing. Our direct service people work very, very hard, and the fact that many of them are only making minimum wages, to me, shameful. So what since I've actually worked in the Central Valley and then also working in the Bay Area, notice that there's a big difference in the cost of living. And so I would like to actually encourage looking at the rate structure and the flat rate structure that's across the state, and looking at supporting rate evaluations based on cost of services with an inclusion in there for cost of living adjustment by regional area.
Thank you.
Thank you.
Well, hello, Assembly Member Weber. I think I met you once last year at Chop's Steakhouse and Seafood. Yes, I do remember meeting her there, but okay, let's get down to business. My name is Rick Hodgkins. I am a client of Alta California Regional Center. I am a member of Capital People First and also a member of the Supported Life Institute's Peer Advocacy Connection Committee. We administer the Supported Life Institute's Self-Advocacy Coordination Project. I also am your Region 3 representative on the State of California Department of Developmental Services that serves 10 counties: Alpine, Colusa, El Dorado, Nevada, Sacramento, Sierra, Sutter, Yolo, and Yuba counties. And I forgot, did I mention Nevada? So Mr. Dickinson, I serve Sacramento County as well. But anyway, I also have been appointed to the Employment First Policy Committee, which is part of the State Council on Developmental Disabilities. And speaking of developmental centers, I just wanted to say that luckily I was born in the 70s at a time when I did not have to go into a DC, although I went to a campus identical to a DC, which is a California School for the Blind, which is in,
We're going to ask you to kind of wrap it up soon, okay? It's okay, Rick. Tell us what you got to say. Finish your statement.
All right. All right. I don't see the.
Right. I know you don't see the signs. I just want to let you know.
Okay. I'm glad. Anyway, we need to fully fund this, because we can't get used to the new normal, as the governor said. The pet projects need to go on hold. We need to protect people first and restore and get rid of this 15-hour flat rate. I was talking to Mr. Chesbro yesterday, and he said the flat limit for ILS services isn't going to work.
Thank you very much.
I'm multitasking now, being the interpreter.
You're doing a good job at it.
Okay. Hi, my name is Jamie. I moved here from a group home. It was an IMD. I had a lot of behaviors. I had a lot of staff was teaching me a lot, and now I've really become independent. I don't have any behaviors. I've really improved. I work at landscaping. I have a lot of friends. I work with my staff, and I'm just really happy. So thank you.
Thank you for sharing that. Mm-hmm.